The pelvic floor muscles are often overlooked, yet they play a critical role in our overall health and well-being. Stretching like a supportive hammock from the pubic bone at the front to the tailbone at the back. The pelvic floor consists of layers of muscles and connective tissue that form the base of the pelvis. These muscles are responsible for a wide array of essential functions, ranging from supporting our internal organs to maintaining continence and even contributing to sexual health. Despite their crucial importance, many people are unaware of what the pelvic floor does, how it can weaken over time, and what steps can be taken to keep it strong and healthy. To understand the importance of pelvic floor muscles, it helps to first appreciate their anatomy and location. Imagine the pelvis as a bowl-shaped structure at the bottom of your abdomen. The pelvic floor forms the bottom of this bowl, holding up organs like the bladder, uterus or prostate, and rectum. The muscles themselves are layered and intertwined, creating a foundation that supports these organs during everyday movements, such as walking, lifting, or even laughing. One of the most critical functions of the pelvic floor is to maintain continence. The muscles encircle the openings of the urethra, vagina or penis, and rectum, providing control over the release of urine, feces, and, in women, vaginal discharge. When the pelvic floor is strong and responsive, these openings remain closed until you consciously decide to release them. This is why a healthy pelvic floor is essential for preventing conditions like urinary incontinence, which affects millions of people worldwide. Weakness in these muscles can lead to involuntary leakage of urine or stool, a problem that can be frustrating, embarrassing, and significantly impact quality of life. Pelvic floor health is not just about continence, though. These muscles also play a vital role in sexual function. In women, a strong pelvic floor can enhance sensation and improve sexual satisfaction, while in men, it contributes to erectile function and ejaculatory control. Weakness in this area may lead to decreased sexual enjoyment, pain during intercourse, or difficulty achieving orgasm. The pelvic floor also supports our internal organs. Over time, factors like pregnancy, childbirth, obesity, aging, and even chronic coughing can place excessive strain on these muscles. When the pelvic floor becomes weak, it may not be able to fully support the organs above, leading to conditions known as pelvic organ prolapse. In these cases, organs such as the bladder, uterus, or rectum can descend into the vaginal canal, causing discomfort, a sensation of pressure, and problems with urination or bowel movements. Maintaining a strong pelvic floor is important for everyone, regardless of age or gender. For women, pregnancy and childbirth are common causes of pelvic floor weakness. The weight of a growing baby, hormonal changes, and the physical stresses of labor can stretch and strain the muscles, sometimes resulting in lasting damage. Men, too, can experience pelvic floor issues, particularly as they age or if they undergo surgery for prostate problems. Athletes and individuals who lift heavy weights are also at risk, as repeated pressure can challenge the muscle's ability to support the pelvic organs. Recognizing the signs of pelvic floor dysfunction is crucial. Symptoms may include leaking urine when coughing, sneezing, or exercising, a frequent urge to urinate, difficulty emptying the bladder or bowels, pain during intercourse, or a feeling of heaviness or bulging in the pelvic area. If you experience any of these symptoms, it's important to seek advice from a healthcare professional. Early intervention can prevent further complications and improve quality of life. Preventing and treating pelvic floor issues starts with awareness and education. Regular exercise is key. Simple but effective movements, often referred to as Kegel exercises, can help strengthen the pelvic floor muscles. To perform a Kegel, imagine you are trying to stop the flow of urine midstream. The muscles you contract are your pelvic floor muscles. By tightening and holding these muscles for several seconds before releasing, and repeating this process several times a day, you can build strength and endurance. Both men and women can benefit from these exercises, and they can be done discreetly almost anywhere. Beyond Kegels, other strategies can support pelvic floor health. Maintaining a healthy weight reduces pressure on the pelvic floor. Good posture and proper lifting techniques help prevent unnecessary strain. Avoiding constipation by eating a fiber-rich diet and staying hydrated is also important, as straining during bowel movements can weaken these muscles. For some individuals, specialist physical therapy may be beneficial. Pelvic floor therapists are trained to assess and guide personalized exercise programs, helping patients regain strength and function. Lifestyle modifications can also make a difference. Smoking cessation reduces coughing, which can otherwise challenge the pelvic floor. Managing chronic conditions like diabetes and respiratory disorders helps prevent complications. Staying active through walking, swimming, and low-impact exercise promotes circulation and muscle tone. For people who have already developed pelvic floor problems, a range of treatments is available. Physical therapy remains the cornerstone, but in some cases, medications, pessaries, or surgical interventions may be necessary. The most important step is to address these concerns early, rather than waiting until symptoms become severe. The benefits of a strong pelvic floor extend far beyond physical health. People who maintain good pelvic floor function often report improved confidence, greater freedom in daily activities, and enhanced enjoyment in their relationships. This sense of well-being is rooted in the knowledge that their bodies are supported and functioning as they should. Although pelvic floor health is relevant to everyone, certain life stages make it especially important. Adolescence, pregnancy, postpartum recovery, menopause, and aging all bring changes that can affect the pelvic floor. Staying proactive through regular exercise, healthy habits, and routine checkups can help prevent problems before they arise. In summary, the pelvic floor muscles are the unsung heroes of our bodies. They provide support for our organs, maintain continence, enable sexual function, and contribute to overall stability and comfort. By understanding their role, recognizing the signs of dysfunction, and taking steps to keep them strong, we empower ourselves to lead healthier, more confident lives. No matter your age or gender, prioritizing pelvic floor health is an investment in your future well-being. So take a moment to appreciate the work these muscles do every day, and consider what you can do to keep them strong and resilient for years to come.